Picture a hospital ward. Late evening. The lights are low, the corridors are quiet, and the nurses on duty are doing what they always do. Monitoring patients, checking charts, moving efficiently through the practiced routines of care. Then the phone rings. A confident male voice identifies himself as Dr. Smith from the psychiatry department. He needs a favor. One of his patients on the ward, a Mr. Jones, needs to be given a medication called Astraten, 20 milligrams, right away. He's in a hurry. He'll come by to sign the authorization paperwork later. The nurse pauses. She checks the medicine cabinet. There is a bottle of Astraten, but the label says the maximum daily dose is 10 milligrams. Dr. Smith is asking for double that, and there's something else. The name Dr. Smith doesn't appear anywhere on the list of physicians authorized to prescribe medication on this ward. Technically, everything about this call violates protocol. The nurse has never met this doctor. She cannot verify his identity. The dose is dangerously high. There is no written order. There is no authorization. She should refuse. She knows she should refuse. She reaches for the medication anyway, and so did 20 others just like her. Welcome back to The Darkest Experiments, the series that reaches into the most disturbing corners of psychological research to ask the questions science and society would rather not answer. Last time, we stood beside Stanley Milgram's participants as they pressed switches on a machine they believed was delivering lethal shocks, because a man in a lab coat told them to continue. We watched ordinary people abandon their own moral instincts in the presence of authority. Today, we leave the laboratory entirely. Today, the experiment takes place in a real hospital with real nurses and a real patient lying in a real bed. The stakes were genuine. The danger was genuine. And the results were, in many ways, even more alarming than Milgram's. This is the Hofling Hospital experiment. And by the time we're done, you will never think about the word authority the same way again. The year is 1966. Stanley Milgram's obedience studies have already shaken the academic world. But a psychiatrist named Charles Hofling is sitting with a nagging question that Milgram's work left unanswered. Yes, Milgram proved that people will obey authority in a controlled laboratory setting, with a white-coated experimenter physically present, with institutional prestige all around them, with the full staging of a formal scientific environment. But what about the real world? What happens when authority arrives not in person, but as a disembodied voice on a telephone? When there is no face, no badge, no physical presence, just a voice, a title, and an expectation? Hofling was particularly interested in hospitals. Healthcare is a hierarchical system built on chains of command, and the relationship between doctors and nurses has traditionally been one of significant power imbalance. Doctors give orders. Nurses follow them. That was the cultural norm of the era, and to a considerable degree, it still echoes today. Hofling wanted to know if a doctor, even an unknown, unverifiable doctor, gave a nurse an instruction over the phone that violated every written protocol in the book, what would she do? He designed an experiment to find out, and it was devastatingly simple. Hofling selected 22 real nurses working real shifts in real hospital wards across the United States. None of them knew they were part of a study. Before the experiment began, a fictional drug called Astraten was placed in the medicine cabinet of each ward. The bottle's label clearly stated the maximum safe daily dose, 10 milligrams. Then, one by one, each nurse received a phone call. The caller identified himself as Dr. Smith, a psychiatrist from the hospital's own department. He explained that he was about to come in to see a patient, a Mr. Jones, and that he needed the nurse to administer 20 milligrams of Astraten to prepare the patient for his arrival. He would sign the authorization forms when he got there. That was it. A phone call. A name. A request. Now let's be precise about what the nurse was being asked to do. She was being asked to administer double the maximum stated dose of a medication. She was being asked to act on the verbal instruction of a doctor she had never met, whose identity she could not confirm, whose name did not appear on the approved prescriber list. She was being asked to do all of this without any written order, which in itself was a direct violation of hospital policy. Any one of those factors alone should have been sufficient grounds for refusal. All three together? The answer should have been clear. And yet, 21 out of 22 nurses reached for the medication and began to prepare the dose. 21 out of 22. They were stopped before any patient was actually harmed. A researcher was observing and intervened at the moment the nurse picked up the medication. But the intent was unambiguous. These nurses were going to follow the instruction. Only one nurse refused. 1 out of 22. After the experiment was revealed, Hofling interviewed the nurses to understand their reasoning. And what they said is remarkable, not because it is strange, but because it is so utterly recognizable. Many said they had noticed the problems. They were aware the dose was higher than stated on the label. They knew they hadn't been able to verify the doctor's identity. They knew there was no written order, but doctors gave instructions like this all the time, they said. If you questioned every order, you'd slow everything down. If a doctor said it was necessary, it probably was. He was the expert. He was the authority. Who were they to second-guess a physician? And underneath all of that, unspoken but palpable, was the fear of what would happen if they did refuse, of being seen as difficult, of being reported, of being wrong. Hofling also surveyed a separate group of nurses and nursing students before the experiment, asking them to predict what they would do in that scenario. The overwhelming majority said they would refuse. They were confident of it? The gap between what people believe they would do and what they actually do is one of the most consistent and unsettling findings across all of psychology. We are not as resistant as we think we are. We are not as independent as we feel. What Hofling had uncovered was something Milgram had pointed toward but not fully mapped, the way authority operates at a distance. You don't need a white coat in the room. You don't need a physical presence. You don't even need a face. You just need a title delivered with confidence in a context where deference to that title is the social norm. In a hospital, that title is doctor. In other environments, it might be manager or director or the government or the algorithm. The content changes. The mechanism is identical. And this matters enormously because the modern world is full of disembodied authority. Emails from supervisors, instructions from platforms, policies issued by organizations whose faces we never see. The Hofling experiment, conducted in 1966 with a rotary telephone, is arguably more relevant now than it has ever been. There is another dimension worth sitting with, which is the structural one. The nurses in this study were not weak people. They were trained professionals operating within a system that had spent years teaching them to trust the hierarchy, to avoid friction, to keep things running smoothly. The problem was not the nurses. The problem was the system. When we design institutions that punish questioning and reward compliance, we should not be surprised when people comply, even when compliance is dangerous. The failure is not individual, it is architectural. Hofling's methodology raised its own ethical concerns. The nurses were not told they were being observed. They were placed in a situation of genuine stress, made to feel complicit in something that could have harmed a patient. The revelation that it was all a test was undoubtedly a relief, but the experience of the deception itself was not nothing. And there is the deeper question. Is it ethical to test healthcare workers in their actual workplace with actual patients nearby, using manufactured scenarios of medical risk? The answer is uncomfortable because the study is so important. Healthcare has changed because of it. Training has changed. Protocols about phone orders have changed. Can you weigh the distress caused to 22 nurses against improvements to patient safety that may have protected thousands? There is no clean answer. But these are exactly the questions that make the history of psychological research so necessary to understand. Here is the practical truth that Hofling left us with. Authority is not the same as correctness. A title does not equal wisdom. A confident voice on a phone does not equal a command you are obligated to follow, especially when something feels wrong. The one nurse who refused in this study did something that sounds simple and is, in practice, profoundly difficult. She paused. She checked. She held her ground against the social pressure of a professional hierarchy and said, "This doesn't meet the standard. I need more before I proceed." That pause, that check, that willingness to absorb momentary discomfort in service of a deeper responsibility, that is not insubordination. That is integrity. Whatever your field, whatever your environment, you will face moments when an authority figure, real or perceived, present or remote, asks you to do something that quietly troubles you. The Hofling experiment is a standing invitation to practice what that one nurse did. Pause. Check. Hold your ground. The Hofling Hospital experiment never became as famous as Milgram's work. It didn't have the same dramatic staging, the same shocking statistics, the same cinematic arc. But in some ways, that's precisely what makes it more frightening. It was quiet, ordinary. A phone call in a medicine cabinet. No laboratory, no shocks, no performance. Just a voice, a title, and a decision made in a moment of deference that nearly caused genuine harm. In our next episode, we leave the hospital and step into a classroom in California, where a high school history teacher decides to show his students exactly how fascism begins. What he set in motion over the course of 5 days will disturb you, inspire you, and stay with you long after this episode ends. That is the story of the third wave, and it starts in the next video. If this experiment surprised you, unsettled you, or made you think about authority in a new way, leave a comment below and tell me what your reaction was. I read every single one. And if you haven't subscribed yet, now is a great time. This series is only getting more intense from here. I'll see you in the next one.